All right, cranial nerve 6, maybe a little bit less complicated. The sixth nerve only really controls the lateral rectus, which makes the eye look outwards towards the side. So if it's knocked out, then you're going to have a cross eye. Causes, once again, diabetes, hypertension, those vasculitic things that give you a little stroke to the nerve. But you also need to think about intracranial pressure. I'll discuss that in 1 second. So how does it look? Now this is a right Six Palsy. Watch that right eye when it looks out to the side. It doesn't get out there all the way. And look over there, it looks pretty good. So you can imagine this patient says, I've got double vision every time I look to the right, because that right eye is not getting out of there. It's causing more crossing in that direction of gaze. When you see something like this, we know theoretically what a sixth nerve palsy ought to look like. But, knowing what it should look like and actually looking at a real live patient sitting before you, it's not always obvious. It really isn't. Yeah, it's obvious when we talk about it and you see it in the cartoon version, but it's not always obvious. So just document. You just write down which eyes don't get out, then you can sit down and say, you know what, that makes sense for a sixth nerve palsy. This drawing really is to serve one purpose, and that's one of the extra causes of a sixth nerve palsy is high intracranial pressure, or pseudotumor cerebri, or idiopathic intracranial hypertension, whatever you want to call it. But if you have high intracranial pressure, which is common, especially the what is it, the fours, young women in their 40s or fertile, I guess the Fs, 40, fertile, obese. Women tend to be a little bit more commonly get high intracranial pressure, but anyway, high pressure around the brain affects the sixth nerve. And here's a theory why. The sixth nerve is down here in the pons, basically pops out the bottom of the pons, runs up the floor of the cranial vault, runs near Dorello's canal before popping into the cavernous sinus. And one theory is that something about this turn right here, I didn't really draw it very well, but there's a almost 90-degree turn from this cranial nerve 6, because it's having to go way up here, then turn suddenly. Maybe there's something about this turn here, this 90-degree angle, that is very susceptible to pressure. Maybe pressure pushes the brain around, who knows, but something about this turn is one theory why high pressure seems to hit cranial nerve 6. But you'll get a young person in who has double vision, and you'll find they have a bilateral cranial nerve 6 palsy. You look inside their eye, and they have some papilledema or some swelling of their optic nerves on both sides. You got to start thinking about high intracranial pressure. Send them off to the neurologist, get a spinal tap, get an opening pressure, and find out what it is.